The morning sun cast long shadows through the glass doors of St. Margaret's Medical Center as Dr. Marcus Sterling adjusted his pristine white coat for the third time. Everything about Marcus screamed perfection, from his perfectly styled dark hair to his Italian leather shoes that clicked authoritatively against the polished hospital floors. At 38, he was the youngest chief of surgery the hospital had ever appointed, and he never let anyone forget it. Marcus had built his reputation on two things: his exceptional surgical skills and his complete intolerance for incompetence. He demanded excellence from everyone around him, and those who couldn't meet his standards quickly found themselves on the receiving end of his sharp tongue. The hospital staff had learned to walk on eggshells around him, especially the nursing staff, whom he viewed as nothing more than assistants to carry out his orders without question. Dr. Sterling called out Rebecca Chen, the head of nursing, as she hurried down the hallway with a clipboard clutched to her chest. Rebecca had worked at St. Margaret's for 15 years and had seen many surgeons come and go, but none quite like Marcus. "We need to discuss the staffing situation for today's surgeries." Marcus didn't bother to slow his pace as Rebecca fell into step beside him. "What about it? I assume you've arranged for competent nurses as requested." "Well, that's what I need to talk to you about," Rebecca said, slightly out of breath from trying to keep up. "We're short-staffed today. 2 of our regular nurses called in sick, and another is dealing with a family emergency. I've managed to find a temporary replacement, but she's new to our hospital." Marcus stopped abruptly, causing Rebecca to nearly collide with him. His ice-blue eyes narrowed as he turned to face her. "A temporary nurse? For my surgeries? Rebecca, you know I don't work with unknowns. My operations require precision and experience, not some random person pulled from a temp agency." "I understand your concerns, Dr. Sterling, but this nurse comes highly recommended. She has extensive experience in surgical settings, and her references are impeccable. Her name is Sarah Mitchell, and she'll be assisting in your procedures today." Marcus let out an exasperated sigh and pinched the bridge of his nose. "Fine. But I want it understood that if this temporary nurse makes even the slightest mistake, she's out. I won't have my reputation tarnished by someone who doesn't belong in my operating room." Rebecca nodded quickly, though something in her expression suggested she wanted to say more. Instead, she simply handed him the updated surgery schedule and watched as he strode away toward the surgical wing, his confidence radiating with every step. The surgical wing of St. Margaret's was Marcus's domain, and he ruled it like a king. The operating rooms were state-of-the-art facilities equipped with the latest technology, and Marcus had personally overseen the selection of every piece of equipment. He believed that excellence in surgery required excellence in every detail, from the instruments to the lighting to the people who assisted him. As Marcus entered OR3 to prepare for his first surgery of the day, he noticed a woman he didn't recognize checking the surgical instruments. She appeared to be in her early 30s, with auburn hair neatly pulled back and an air of quiet confidence as she methodically examined each tool. Her scrubs were standard hospital issue, but something about the way she carried herself suggested she was comfortable in this environment. "You must be the temporary nurse," Marcus said, his voice carrying just enough disdain to make his opinion clear. "I'm Dr. Sterling. I assume you've been briefed on my expectations." The woman looked up from the instrument tray, and Marcus found himself meeting a pair of steady green eyes that showed neither intimidation nor deference. "Sarah Mitchell," she said simply, extending her hand. "I'm here to assist with today's surgeries." Marcus ignored the offered handshake and instead picked up his surgical cap. "Let me be very clear, Miss Mitchell. I run a tight operation here. I don't tolerate delays, excuses, or incompetence. You'll speak only when spoken to, you'll anticipate my needs before I have to ask, and you'll stay out of my way unless I specifically require something from you. Is that understood?" Sarah's expression remained neutral, though Marcus thought he detected the slightest hint of amusement in her eyes. "Understood, Dr. Sterling." "Good. Now, have you reviewed the surgical plan for this morning's procedures?" "I have. We're starting with a gallbladder removal, followed by an appendectomy, and finishing with a more complex bowel resection. I've prepared the appropriate instrument sets for each procedure and verified that all equipment is functioning properly." Marcus was slightly surprised by her thorough response but wasn't about to show it. At least you can read. Let's see if you can follow instructions as well. The first surgery began at exactly 8 o'clock, just as Marcus preferred. He prided himself on running on schedule, viewing any delay as a sign of poor planning and execution. As he made the first incision for the gallbladder removal, he was acutely aware of Sarah's presence at his side, ready to assist. "Forceps," Marcus said, not bothering to look up from the surgical site. The instrument was in his hand before he'd finished speaking, placed with a precision that impressed him despite himself. Throughout the procedure, Sarah anticipated his needs with an uncanny accuracy, having the right tool ready at exactly the right moment. Her movements were efficient and confident, and she maintained perfect sterile technique throughout. Despite her competence, Marcus found himself increasingly irritated by something he couldn't quite identify. Perhaps it was the way she didn't seem intimidated by his reputation, or how she carried herself with the same confidence he'd worked years to develop. Most temporary nurses were nervous and eager to please, constantly seeking his approval. Sarah simply did her job with quiet efficiency. "Suction," Marcus commanded as he worked to control some minor bleeding. Once again, the instrument appeared in his hand immediately, and the bleeding was cleared with perfect timing. Marcus couldn't find fault with her technique, which only served to increase his frustration. He was accustomed to being the undisputed authority in his operating room, but Sarah's competence somehow made him feel like she was evaluating him rather than the other way around. As the surgery progressed, Marcus decided to test this mysterious temporary nurse. He began making requests more rapidly, occasionally asking for instruments in an unusual sequence, hoping to catch her off guard. But Sarah kept pace with him effortlessly, never missing a beat or showing any sign of confusion. "Dr. Sterling," Sarah said quietly as he prepared to close the incision, "you might want to check the posterior aspect of the gallbladder bed. I noticed some irregular tissue during the dissection." Marcus's hands stilled for a moment. It was highly unusual for a nurse to make such an observation, and even more unusual for one to voice it during surgery. His first instinct was to dismiss her comment, but something in her tone made him pause. Reluctantly, he took another look at the area she'd mentioned. To his surprise, he found a small area of inflamed tissue that he'd missed in his initial examination. It wasn't immediately dangerous, but it was something that should be addressed to prevent future complications. Marcus carefully removed the problematic tissue, his jaw tightening as he realized that the temporary nurse had caught something he'd overlooked. "Good catch," he admitted grudgingly, though his tone made it clear he wasn't pleased about it. "Thank you, Dr. Sterling," Sarah replied, her voice maintaining the same professional neutrality it had carried throughout the procedure. The remainder of the surgery proceeded without incident, and Marcus had to admit, albeit only to himself, that it had gone more smoothly than many procedures with his regular nursing staff. Sarah's competence was undeniable, but that only made her more puzzling to him. Temporary nurses with her level of skill didn't usually end up working random shifts at hospitals. As they moved on to the second surgery of the day, Marcus found himself paying closer attention to Sarah's technique and knowledge. During the appendectomy, she demonstrated familiarity with several advanced surgical procedures that most nurses wouldn't encounter in their regular work. When he mentioned a specific type of suture that he preferred for abdominal closures, she not only knew exactly what he meant but had already prepared the appropriate materials. "Where did you train?" Marcus asked during a brief pause in the procedure, his curiosity finally overcoming his usual reluctance to engage in conversation with support staff. "Various places," Sarah replied vaguely, her attention focused on organizing the instruments for the final phase of the surgery. "That's not very specific," Marcus pressed, but Sarah seemed to have nothing more to add on the subject. The appendectomy concluded successfully, and they prepared for the final surgery of the morning, the bowel resection. This was a more complex procedure that would truly test Sarah's abilities. Bowel surgery required precise coordination between surgeon and nursing staff, as the procedure involved multiple phases and frequent instrument changes. As Marcus began the complex dissection required to access the affected portion of bowel, he noticed that Sarah had anticipated the need for specialized retractors and had them ready before he asked. Her understanding of the procedure was becoming increasingly evident, and Marcus found himself wondering what her background really was. "How long have you been doing surgical nursing?" he asked as he carefully separated adhesions around the intestine. "Long enough," Sarah replied, handing him a different retractor without being asked. Marcus was becoming frustrated with her evasive answers, but he was also impressed despite himself. The surgery was proceeding exceptionally well, and Sarah's assistance was proving invaluable. She seemed to understand not just the technical aspects of the procedure but also the nuances of his personal surgical style. As they reached the most delicate phase of the operation, Marcus prepared to remove the diseased section of bowel and reconnect the healthy portions. This required precise suturing and careful attention to blood supply, and any mistake could result in serious complications for the patient. "Dr. Sterling," Sarah said quietly, "you might want to consider a slightly different approach to the anastomosis. The blood supply to that segment looks somewhat compromised." Marcus paused, his hands hovering over the surgical site. Once again, the temporary nurse was making an observation about his surgical technique. His first impulse was to ignore her suggestion and proceed as planned, but something about her quiet confidence made him reconsider. Looking more carefully at the tissue, Marcus realized that Sarah was right. The blood supply to the area where he'd planned to create the connection was indeed questionable. Making the connection in a slightly different location would provide better blood flow and reduce the risk of complications. "You're right," Marcus said, his voice tight with reluctance. "We'll modify the approach." The surgery concluded successfully with the modified technique, and Marcus had to admit that Sarah's suggestions had improved the outcome for the patient. As they completed the final sutures and prepared to close, Marcus found himself in the unusual position of being grateful for input from a nurse. As the morning's surgeries came to an end, Marcus found himself more puzzled than ever about Sarah Mitchell. Her knowledge and skills far exceeded what he would expect from a typical temporary nurse, and her confidence in making surgical recommendations suggested a background he couldn't quite identify. "Where did you say you worked before coming here?" Marcus asked as they completed the post-operative documentation. "I didn't say," Sarah replied with what might have been the hint of a smile. "But thank you for a smooth morning, Dr. Sterling." The surgeries went very well. As Sarah gathered her things and prepared to leave, Marcus realized that despite his initial reservations, the morning had indeed gone exceptionally well. Her assistance had been flawless, and her observations had actually improved his surgical outcomes. It was a humbling realization for someone who prided himself on needing no one's help. But, as Marcus watched Sarah walk away, he couldn't shake the feeling that there was much more to this mysterious temporary nurse than met the eye. Her evasive answers about her background, her exceptional surgical knowledge, and her quiet confidence all suggested that Sarah Mitchell was not what she appeared to be. Little did Marcus know that his afternoon would bring revelations that would completely change his understanding of who Sarah Mitchell really was, and force him to confront his own arrogance in ways he never could have imagined. The cafeteria at St. Margaret's Medical Center buzzed with the usual lunchtime chatter as Marcus Sterling sat alone at his customary corner table, picking at a salad he'd barely touched. His mind kept wandering back to the morning surgeries and the enigmatic temporary nurse who had somehow managed to both impress and irritate him simultaneously. Sarah Mitchell's competence had been undeniable, but her mysterious background gnawed at him like an itch he couldn't scratch. Marcus prided himself on being able to read people quickly and accurately. In his world, understanding the capabilities and limitations of those around him was essential for maintaining his position of authority. But Sarah had defied his ability to categorize her, and that bothered him more than he cared to admit. "Mind if I join you?" Marcus looked up to see Dr. Jennifer Walsh, the hospital's chief of cardiology, standing beside his table with her lunch tray. Jennifer was one of the few colleagues Marcus respected, partly because she was brilliant at her job and partly because she didn't tolerate his arrogance any more than necessary. "Of course," Marcus replied, gesturing to the empty chair across from him. Jennifer settled into her seat and studied Marcus with the same analytical gaze she used when reviewing cardiac imaging. "You look troubled. Rough morning in surgery?" "Actually, quite the opposite," Marcus admitted, stabbing a piece of lettuce with perhaps more force than necessary. "The surgeries went exceptionally well. Then, why do you look like someone stole your favorite scalpel? Marcus set down his fork and leaned back in his chair. We had a temporary nurse today. Sarah Mitchell. Do you know her? Jennifer raised an eyebrow. Can't say that I do. But, temporary staff come and go so frequently, it's hard to keep track. Was there a problem with her performance? That's just it, Marcus said, his frustration evident in his voice. There was no problem at all. She was exceptional. Too exceptional for a temporary nurse. And this bothers you because it doesn't make sense, Jennifer. Nurses with her level of skill and knowledge don't usually end up working temporary assignments at random hospitals. There's something she's not telling me about her background. Jennifer smiled knowingly. Ah, I see. The great Dr. Sterling is puzzled because someone doesn't fit neatly into one of his predetermined categories. How refreshing. Marcus bristled at her tone. This isn't about categories. It's about understanding who I'm working with. Sarah made surgical recommendations that were not only appropriate but actually improved patient outcomes. That's not typical nursing behavior. Maybe you should ask Rebecca about her credentials, Jennifer suggested, though her expression suggested she found Marcus's discomfort amusing. I'm sure human resources vetted her properly before allowing her to work in the OR. I plan to, Marcus replied, though he realized he'd been so focused on the mystery of Sarah's competence that he hadn't thought to check her official credentials. There's something about her that doesn't add up. Before Jennifer could respond, her pager buzzed urgently. She glanced at the display and immediately stood up. Emergency in the cardiac unit. I have to go. She paused and looked down at Marcus with a slight smile. Maybe your mysterious nurse is just very good at her job. Try not to let it bruise your ego too much. As Jennifer hurried away, Marcus found himself alone with his thoughts once again. He realized that part of what bothered him about Sarah was that she had treated him as an equal rather than deferring to his authority. Most nurses, especially temporary ones, were eager to please and quick to acknowledge his expertise. Sarah had simply done her job with quiet competence, offering suggestions when appropriate without seeking his approval or praise. Marcus finished his lunch quickly and headed to the administrative offices to find Rebecca Chen. If anyone would have information about Sarah Mitchell's background, it would be the head of nursing. He found Rebecca in her office, surrounded by the usual chaos of scheduling charts and personnel files. Dr. Sterling, Rebecca said, looking up from her computer screen with surprise. Is everything all right? How did the surgeries go with Sarah? They went well, Marcus admitted reluctantly. Actually, they went very well. That's why I'm here. I'd like to know more about Sarah Mitchell's background. Rebecca's expression became slightly guarded. Is there a problem with her performance? Because if there is. No problem with her performance, Marcus interrupted. Quite the opposite. She demonstrated knowledge and skills that seem unusual for a temporary nurse. I'm curious about her training and experience. I see, Rebecca said, though she seemed to be choosing her words carefully. Sarah's credentials are certainly impressive. She has extensive experience in surgical settings and excellent references from previous positions. Previous positions where? Marcus pressed. Rebecca hesitated for a moment before responding. Her most recent position was overseas. She's been working in various medical facilities internationally. The temp agency was able to verify her credentials and licenses, and everything checked out properly. Overseas where, exactly? I believe she's worked in several countries, Rebecca said vaguely. Her experience includes both civilian and military medical facilities. Military medical facilities. That piece of information caught Marcus's attention immediately. Military medicine operated under different protocols and pressures than civilian hospitals, and it would explain Sarah's confident demeanor and exceptional skills. Military nurses often had training and experience that went well beyond what was typical in civilian settings. How long is her assignment here? Marcus asked. She's available for the rest of the week, possibly longer if we need her, Rebecca replied. Why do you ask? Just planning ahead, Marcus said, though privately he was curious to work with Sarah again and, perhaps learn more about her mysterious background. As Marcus left Rebecca's office, he felt somewhat satisfied with the information he'd gathered, but it still didn't fully explain the puzzle that was Sarah Mitchell. Military experience would account for her competence and confidence, but there was something else about her that he couldn't quite identify. The afternoon brought a new set of challenges as Marcus prepared for emergency surgery on a trauma patient who had been brought in following a serious car accident. The patient had suffered multiple internal injuries and required immediate surgical intervention to save his life. These types of emergency surgeries were exactly the kind of high-pressure situations where Marcus's skills truly shone. As he scrubbed in for the emergency procedure, Marcus was surprised to see Sarah Mitchell preparing for surgery alongside him. He had assumed her assignment was only for the morning's scheduled procedures. I thought your shift was over, Marcus said as he methodically scrubbed his hands and forearms. Rebecca asked if I could stay for the emergency surgery, Sarah replied, her tone as professional and unruffled as it had been that morning. I hope that's acceptable. Of course, Marcus said, though he realized he was actually pleased to have her assistance for such a critical procedure. This is going to be challenging. The patient has significant abdominal trauma with possible damage to multiple organs. I reviewed the CT scans, Sarah said. It looks like there may be liver damage, possible splenic injury, and potential bowel perforation. We should be prepared for extensive repair work. Marcus nodded, impressed once again by her thorough preparation. As they entered the operating room, Marcus felt the familiar surge of adrenaline that came with emergency surgery. This was where he truly excelled, where his skills and experience could mean the difference between life and death for a patient. The trauma patient was already anesthetized and prepped for surgery when they entered the OR. Marcus quickly assessed the situation and began the exploratory procedure to determine the extent of the internal injuries. As he made the initial incision, he could immediately see that the damage was extensive. Significant bleeding from the liver, Marcus announced to the surgical team. Sarah, I'm going to need rapid suction and we'll need to pack the abdomen to control bleeding while we assess the full extent of the injuries. Sarah was ready with the suction immediately, and Marcus noticed that she had already anticipated the need for abdominal packing materials. As they worked to control the bleeding, Marcus realized that Sarah's assistance was proving invaluable in managing the complex emergency. The spleen is severely damaged, Marcus observed as he examined the abdominal cavity. We're going to need to remove it entirely. And there's definitely bowel perforation that will need repair. For the next 3 hours, Marcus and Sarah worked in perfect synchronization to repair the extensive damage. Sarah seemed to anticipate his every need, having instruments ready before he asked and maintaining perfect sterile technique throughout the lengthy procedure. Her knowledge of trauma surgery protocols was evident in her preparation and assistance. Dr. Sterling, Sarah said quietly during a particularly challenging portion of the bowel repair, you might want to consider a staged approach for the remaining repairs. The patient's blood pressure is becoming unstable, and completing everything in one procedure might be too much stress on his system. Marcus paused in his work and looked at the monitoring equipment. Sarah was right, the patient's vital signs were showing stress from the prolonged surgery. A staged approach, where they would complete the most critical repairs now and return later for additional work, would be safer for the patient. Agreed, Marcus said. We'll complete the bowel repair and get him stabilized, then we can address the remaining issues once he's recovered from this procedure. As they worked to complete the critical repairs and prepare the patient for recovery, Marcus found himself increasingly impressed by Sarah's clinical judgment. Her suggestion about the staged approach had been exactly right, and it demonstrated a level of medical knowledge that went well beyond typical nursing training. The surgery concluded successfully, with the patient's vital signs stabilizing as they completed the closure. Marcus felt the familiar satisfaction that came with a successful emergency procedure, but he was also acutely aware that Sarah's contributions had been essential to the positive outcome. Excellent work, Marcus said as they completed the post-operative documentation. Your assistance was invaluable today. "Thank you, Dr. Sterling," Sarah replied. "The patient should do well with proper postoperative care." As they prepared to leave the OR, Marcus realized that he had developed a grudging respect for Sarah Mitchell, despite his initial reservations about working with a temporary nurse. Her skills and knowledge were undeniable, and her contributions had genuinely improved patient care. But Marcus's curiosity about Sarah's background had only intensified throughout the day. Military nursing experience might explain her competence, but her clinical judgment and surgical knowledge suggested training that went beyond what any nurse, military or civilian, would typically have. "Sarah," Marcus said as they walked toward the locker rooms, "I have to ask, what's your real background? Your knowledge and skills are exceptional, even for someone with military experience." Sarah paused in the hallway and turned to face him. For a moment, Marcus thought she might finally give him a direct answer about her background. But, instead, she simply smiled slightly and said, "I've had good teachers, Dr. Sterling. And I've learned that in medicine, there's always more to learn." With that cryptic response, Sarah continued toward the locker room, leaving Marcus more puzzled than ever about the mysterious temporary nurse who had somehow managed to challenge his assumptions and earn his respect in the span of a single day. As Marcus changed out of his surgical scrubs, he couldn't shake the feeling that his encounter with Sarah Mitchell was far from over. Something about her quiet confidence and exceptional abilities suggested that there was much more to her story than she was willing to reveal. And, despite his usual preference for maintaining professional distance from hospital staff, Marcus found himself genuinely curious to learn more about the woman who had so effectively challenged his preconceptions. Little did he know that the next day would bring events that would not only reveal Sarah's true identity but would fundamentally change his understanding of hierarchy, respect, and what it truly meant to be a leader in the medical profession. The next morning arrived with an unusual buzz of activity throughout St. Margaret's Medical Center. Marcus Sterling noticed the increased security presence as soon as he entered the hospital, with additional guards posted at entrances and several men in dark suits conducting what appeared to be security sweeps of various areas. The hospital administrator, Dr. Patricia Williams, was rushing between meetings with a level of urgency that Marcus had rarely seen. As Marcus made his way to the surgical wing, he encountered Rebecca Chen in the hallway, looking more frazzled than usual as she juggled multiple phone calls and a tablet full of scheduling changes. "What's all the commotion about?" Marcus asked, pausing beside Rebecca as she finished one of her calls. "We're hosting a very important visitor today," Rebecca replied, lowering her voice slightly. "A military delegation is coming to tour our trauma facilities. Apparently, they're considering our hospital for some kind of partnership with the local military medical center." "Military delegation?" Marcus's interest was immediately piqued, especially given what he'd learned about Sarah Mitchell's background the previous day. "Anyone I should know about?" "The delegation is being led by General Patricia Harrison," Rebecca explained. "She's the commanding officer of the Regional Military Medical Command. From what I understand, she's quite distinguished, a surgeon herself before moving into administration and command roles." Marcus nodded thoughtfully. The presence of a high-ranking military medical officer would certainly explain the increased security and administrative scrambling he'd observed. It would also provide an interesting contrast to his recent experience with Sarah, giving him a chance to observe how military medical professionals typically conducted themselves. "Will the delegation be observing any surgical procedures?" Marcus asked. "Possibly," Rebecca replied. "Dr. Williams asked me to ensure our best staff are scheduled for today, just in case. Speaking of which, Sarah Mitchell is scheduled to assist you again today." "I hope that's acceptable." "More than acceptable," Marcus found himself saying, surprising himself with the enthusiasm in his voice. "She performed exceptionally yesterday." Rebecca looked pleased but also seemed to be suppressing something that might have been amusement. "I'm glad to hear that, Dr. Sterling. I think you'll find today very interesting." As Rebecca hurried away to attend to more preparations, Marcus continued toward the surgical wing, his mind already focused on the day's scheduled procedures. He had a complex cardiac surgery planned for the morning, followed by a challenging neurosurgical procedure in the afternoon. Both operations would provide excellent demonstrations of St. Margaret's surgical capabilities if the military delegation decided to observe. When Marcus arrived at or 2, he was pleased to see Sarah already present and methodically preparing for the cardiac procedure. She had arrived early and was conducting a thorough review of all equipment and instruments, the same meticulous preparation he'd observed the previous day. "Good morning, Dr. Sterling," Sarah greeted him with the same professional composure he'd come to expect from her. "Good morning, Sarah," Marcus replied, noting that he was beginning to feel comfortable using her first name. "I understand we may have observers today. Military delegation touring the hospital." "So I heard," Sarah said, her expression remaining neutral though Marcus thought he detected the slightest change in her posture. "Are you comfortable with observers during surgery?" "Absolutely," Marcus replied confidently. "In fact, I welcome the opportunity to demonstrate our capabilities. Today's cardiac procedure should showcase both our surgical expertise and our team coordination." As they continued their preoperative preparations, Marcus found himself paying even more attention to the details of their setup. If they were going to be observed by military medical professionals, he wanted everything to be absolutely perfect. Sarah seemed to share his attention to detail, double-checking equipment and supplies with even more thoroughness than usual. The patient for the morning surgery was a 55-year-old man requiring a complex cardiac bypass procedure. The operation would involve rerouting blood flow around blocked coronary arteries, a delicate procedure that required precise coordination between surgeon and support staff. As they began the surgery, Marcus was acutely aware of the smoothness of his collaboration with Sarah. Her anticipation of his needs had improved even further, and she demonstrated an understanding of cardiac procedures that impressed him yet again. When he needed specific sutures or instruments, they were in his hands before he could ask. When complications arose during the procedure, Sarah was ready with appropriate solutions. "Excellent control of the bypass graft," Marcus murmured as he worked to complete a particularly challenging connection. "Sarah, can you adjust the retraction slightly to improve visualization?" Sarah made the adjustment with perfect precision, providing exactly the exposure Marcus needed to complete the delicate suture work. Throughout the procedure, her assistance was so seamless that Marcus began to feel as though they had been working together for years rather than just 2 days. About halfway through the surgery, Marcus became aware of movement in the observation area above the operating room. Looking up briefly, he could see several figures in military dress uniforms watching the procedure. The presence of observers might have made some surgeons nervous, but Marcus felt energized by the audience. This was his opportunity to demonstrate the excellence that had made his reputation. "Dr. Sterling," Sarah said quietly, "you might want to consider a slightly different approach to the next anastomosis. The angle could be improved for better long-term patency." Once again, Sarah was making a surgical recommendation that demonstrated sophisticated understanding of the procedure. Marcus considered her suggestion and realized she was right. A small modification to his approach would indeed improve the long-term success of the bypass. "Good point," Marcus acknowledged, implementing her suggestion. "That will definitely improve the outcome." As the surgery progressed, Marcus found himself wondering what the military observers thought of their performance. The procedure was going exceptionally well, and Sarah's contributions were making him look even better than usual. He began to feel confident that the delegation would be impressed with St. Margaret's surgical capabilities. The cardiac procedure concluded successfully after nearly 4 hours of surgery. As they completed the final sutures and prepared the patient for recovery, Marcus felt the satisfaction that always came with a complex surgery executed flawlessly. "Outstanding work today," Marcus said to Sarah as they began the post-operative documentation. "If we were being evaluated, I'd say we passed with flying colors." "The patient certainly benefited from your skill," Sarah replied diplomatically, though Marcus noticed she seemed less focused on his praise than usual. Her attention seemed to be divided, as if she was listening for something. As they finished cleaning up from the surgery, Marcus heard the sound of footsteps approaching the OR. The door opened to admit Dr. Patricia Williams, accompanied by several individuals in military dress uniforms. Marcus straightened his posture, suddenly, very conscious of making a good impression on the visiting delegation. "Dr. Sterling," Dr. Williams announced with obvious pride, "I'd like you to meet General Patricia Harrison and her staff from the Regional Military Medical Command." Marcus turned toward the group and immediately focused on the individual Dr. Williams had identified as General Harrison. She was an impressive figure, a tall woman with silver hair and the bearing that spoke of decades of military leadership. Her uniform displayed numerous ribbons and insignia that Marcus didn't recognize but clearly indicated significant accomplishments. "General Harrison," Marcus said, stepping forward with his most professional manner, "it's an honor to meet you. I hope you found our surgical demonstration informative." "Indeed I did, Dr. Sterling," General Harrison replied, her voice carrying the authority that came with high military rank. "The cardiac procedure was executed with exceptional skill and precision." "Thank you, General," Marcus said, pleased with the praise. "We pride ourselves on maintaining the highest standards of surgical excellence here at St. Margaret's." "I could see that," General Harrison continued. "Your coordination with your nursing staff was particularly impressive. Teamwork is essential in any successful medical operation." Marcus glanced toward Sarah, intending to acknowledge her contribution to the successful surgery, but stopped short when he noticed something that made his breath catch in his throat. Sarah had straightened to attention in a way that Marcus had never seen from her before, and her entire demeanor had shifted to something that was unmistakably military. "Thank you, General Harrison," Sarah said, her voice carrying a tone of respect that Marcus had never heard from her previously. General Harrison turned toward Sarah with what appeared to be recognition, and Marcus felt a growing sense of confusion as he watched the interaction between them. "It's good to see you again, Colonel Mitchell," General Harrison said with what was clearly more than professional courtesy. "Though I understand you're working under somewhat different circumstances these days." Colonel Mitchell. The words hit Marcus like a physical blow, and he felt his world suddenly shift on its axis. Sarah wasn't just a nurse with military experience, she was a colonel in the military medical corps. Not only was she a military officer of significant rank, but General Harrison obviously knew her personally and respected her professionally. Marcus's mind raced as he tried to process this revelation. Sarah Mitchell wasn't a temporary nurse at all. She was a colonel in the military medical service, which meant she was not only a highly trained nurse but likely a medical professional with authority and experience that potentially exceeded his own. "Colonel Mitchell?" Marcus said, his voice barely above a whisper as the implications began to sink in. Sarah turned toward Marcus, and, for the first time since he'd met her, her professional composure seemed to include a hint of sympathy. "I'm sorry for the deception, Dr. Sterling. My presence here has been somewhat unofficial." General Harrison stepped forward, clearly sensing the tension in the room. "Dr. Sterling, I should explain. Colonel Mitchell is one of our most distinguished military medical officers. She's been on special assignment, and her presence here has been part of an evaluation process we've been conducting." "Evaluation process?" Marcus repeated, feeling increasingly out of his depth as the conversation continued. "We've been assessing civilian medical facilities for potential partnership and collaboration," General Harrison explained. "Colonel Mitchell volunteered to conduct a covert assessment of St. Margaret's surgical capabilities by working directly with your medical staff." Marcus felt as though the ground was shifting beneath his feet. Everything he thought he knew about Sarah Mitchell had been completely wrong. She wasn't a temporary nurse seeking his approval, she was a colonel conducting an evaluation of him and his hospital. Every interaction they'd had over the past 2 days took on an entirely different meaning when viewed through this new lens. "So you've been evaluating me?" Marcus asked, looking directly at Sarah. Colonel Mitchell, with a mixture of embarrassment and growing anger. "Among other things," Sarah replied honestly. "But I want you to know that my assessment of your surgical skills has been entirely positive. You're an exceptional surgeon, Dr. Sterling." Marcus felt his face burning with embarrassment as he realized how he'd treated Sarah over the past 2 days. He'd been condescending and dismissive towards someone who not only outranked him in the military hierarchy but had surgical training and experience that likely exceeded his own. Every patronizing comment he'd made, every instruction he'd given her as if she were a subordinate, now seemed monumentally inappropriate. "I see," Marcus said, struggling to maintain his composure in front of the military delegation. "And what exactly was your assessment of our collaboration?"
Sarah exchanged a glance with General Harrison before responding.
Your surgical skills are outstanding, Dr. Sterling. However, your leadership style and interaction with support staff could benefit from some adjustment. The words were delivered professionally and without malice, but they hit Marcus like a slap in the face. He had spent his entire career building a reputation for excellence and authority, and now he was being told by someone he had treated as a subordinate that his leadership skills were lacking. General Harrison seemed to sense the tension in the room and stepped forward again. Dr. Sterling, I want to emphasize that our evaluation of St. Margaret's Medical Center has been very positive overall. Your surgical capabilities are impressive, and the hospital's facilities are excellent. Marcus nodded mechanically, but his attention remained focused on Sarah, Colonel Mitchell, as he tried to process the complete reversal of everything he thought he understood about their relationship. The quiet confidence he had puzzled over now made perfect sense. The surgical knowledge that had impressed him was exactly what he should have expected from a colonel in the military medical corps. Most humbling of all was the realization that throughout their 2 days of working together, Colonel Mitchell had never once used her superior rank or experience to embarrass him, even when he had been condescending and dismissive toward her. She had simply done her job with professional excellence while allowing him to maintain his authority in the operating room. As the reality of the situation continued to sink in, Marcus began to understand that this encounter was going to fundamentally change not only his understanding of Sarah Mitchell, but his understanding of himself as a leader and medical professional. The silence in the operating room stretched uncomfortably as Marcus Sterling struggled to process the complete upheaval of everything he thought he understood about the past 2 days. Colonel Sarah Mitchell stood before him in her scrubs, but now her quiet confidence and exceptional competence took on an entirely different meaning. General Harrison and her delegation waited patiently, clearly aware that Marcus needed time to absorb the revelation. Dr. Sterling, General Harrison said gently, breaking the silence, perhaps we could continue this discussion in a more appropriate setting. I believe Dr. Williams has arranged a conference room where we can talk more privately. Marcus nodded mutely, his mind still reeling from the discovery that he had spent 2 days treating a military colonel as if she were a subordinate temporary nurse. As they left the operating room, he found himself walking beside Sarah, Colonel Mitchell, in a completely different dynamic than had existed just moments before. I owe you an apology, Marcus said quietly as they walked down the hallway toward the conference room. No apology necessary, Dr. Sterling, Sarah replied in the same professional tone she had maintained throughout their time working together. You treated me as you would treat any temporary nurse on your staff. My assessment was based on observing your normal professional behavior. Her words, while diplomatically phrased, made Marcus wince internally. His normal professional behavior had been condescending and dismissive, and he was now acutely aware of how that must have appeared to someone of Colonel Mitchell's training and experience. The conference room that Dr. Williams had arranged was one of the hospital's more formal meeting spaces, with a large polished table and comfortable chairs arranged for a proper business discussion. As they settled into their seats, Marcus found himself in the unusual position of not knowing exactly what his role should be in this conversation. General Harrison took the lead, her military bearing evident as she addressed the assembled group. Let me begin by thanking St. Margaret's Medical Center for accommodating our assessment process. I want to assure everyone that our evaluation has been very positive overall. Dr. Williams beamed with obvious pride, but Marcus remained focused on Colonel Mitchell, still trying to reconcile the competent nurse he had worked with for 2 days with the military officer she actually was. Colonel Mitchell, General Harrison continued, would you share your assessment of the surgical capabilities and team dynamics you observed? Sarah straightened slightly in her chair, and Marcus could now see clearly the military officer that her civilian scrubs had concealed. General, I found the surgical facilities at St. Margaret's to be excellent, with state-of-the-art equipment and strong safety protocols. The surgical outcomes I observed were outstanding. And the staff interactions? General Harrison prompted, her gaze shifting briefly toward Marcus. The surgical skills of the medical staff are exceptional, Sarah replied carefully. Dr. Sterling, in particular, demonstrates remarkable technical ability and achieves excellent patient outcomes. However, I did observe some areas where leadership and communication styles could be enhanced to optimize team performance. Marcus felt his face burn with embarrassment, but he forced himself to listen to Sarah's assessment. She was being diplomatic, but the message was clear: his technical skills were excellent, but his people skills needed work.
Could you be more specific about those observations? General Harrison asked.
Sarah glanced briefly at Marcus before responding, and he could see that she was choosing her words carefully to be constructive rather than critical. In high-stress medical environments, effective leadership requires not only technical expertise but also the ability to create an atmosphere where all team members feel valued and empowered to contribute their knowledge and observations. The best surgical outcomes occur when the entire team works collaboratively. And you observed situations where this collaborative approach could have been stronger? General Harrison pressed. Yes, ma'am, Sarah replied honestly. There were instances where team members might have been more comfortable contributing observations or suggestions if the communication dynamics had been more collegial. Marcus realized that Sarah was referring to their interactions over the past 2 days, when she had made valuable surgical observations despite his dismissive attitude. Her suggestions had actually improved patient outcomes, but she had made them despite, rather than because of, the collaborative environment he had created. Dr. Williams looked concerned at this feedback, clearly worried about how it might affect the potential military partnership. Dr. Sterling has always been one of our most skilled surgeons, she said defensively. Absolutely, General Harrison agreed quickly.
Colonel Mitchell's assessment of Dr. Sterling's surgical abilities has been consistently positive. The feedback about team dynamics is meant to be constructive, not critical.
Marcus found his voice for the first time since the revelation of Sarah's true identity. Colonel Mitchell, I would very much like to hear your specific observations and recommendations. I realize now that I may not have created the best collaborative environment during our work together.
Sarah looked at him with what might have been approval at his willingness to listen to feedback.
Dr. Sterling, your surgical skills are truly exceptional, and your dedication to patient care is evident. However, I observed that some team members seemed hesitant to share observations or suggestions, even when they might have valuable input to offer. Marcus nodded, remembering his own dismissive attitude when Sarah had first made surgical recommendations. At the time, he had been annoyed that a temporary nurse was presuming to offer suggestions. Now he realized that her recommendations had improved patient outcomes and that his attitude had discouraged exactly the kind of collaborative input that could enhance surgical results.
What would you recommend for improving team collaboration?
Marcus asked, surprising himself with his genuine interest in her answer. In military medical settings, we found that creating an environment where all team members feel comfortable contributing their expertise leads to better outcomes, Sarah explained. This doesn't mean compromising the surgeon's ultimate authority and decision-making responsibility, but rather ensuring that valuable input from experienced team members is welcomed and considered.
General Harrison nodded approvingly.
Colonel Mitchell has extensive experience in developing effective medical teams, both in military and civilian settings.
Her observations could be very valuable for enhancing your already excellent surgical program.
As the conversation continued, Marcus found himself genuinely engaged in learning from Sarah's insights about team dynamics and leadership. Her military experience had given her perspectives on medical team collaboration that he had never considered, and he began to see how his autocratic approach might have been limiting the effectiveness of his surgical teams.
Colonel Mitchell, Marcus said during a pause in the discussion, I have to ask, why didn't you correct my behavior during our time working together? You clearly have the authority and experience to have done so. Sarah smiled slightly, the first time Marcus had seen her drop her complete professional composure. My mission was to observe normal operations, not to disrupt them. Revealing my identity would have changed the dynamics I was supposed to assess.
But you must have found my attitude difficult to tolerate, Marcus admitted.
I've worked in challenging environments before, Dr. Sterling, Sarah replied diplomatically.
And I want to emphasize that despite the communication style, your commitment to patient care and surgical excellence was never in question. Dr. Williams, who had been listening to this exchange with obvious concern, finally spoke up.
What does this mean for our potential partnership with the Military Medical Command?
General Harrison looked around the table before responding. Overall, our assessment of St. Margaret's Medical Center has been very positive. The facilities are excellent, the surgical capabilities are outstanding, and the potential for collaboration is significant. Colonel Mitchell's observations about team dynamics are meant to help enhance an already strong program, not to disqualify it. Marcus felt a wave of relief, but also a strong desire to address the issues that had been identified. General Harrison, if the partnership moves forward, would it be possible for Colonel Mitchell to work with our staff on team development? I believe her insights could be valuable for our entire surgical program. Sarah looked surprised at his request, and General Harrison raised an eyebrow with interest. That's an interesting suggestion, Dr. Sterling. Colonel Mitchell does have extensive experience in medical team development. I would welcome the opportunity to learn from her expertise, Marcus continued, realizing as he spoke that he genuinely meant it. These past 2 days have shown me that there's always room for improvement, even for experienced surgeons. The meeting continued for another hour, covering the practical details of the potential partnership between St. Margaret's Medical Center and the Military Medical Command. As the discussion progressed, Marcus found himself viewing Sarah in an entirely different light. Her knowledge, experience, and leadership capabilities were impressive, and he began to understand how much he could learn from her approach to medical team management. When the formal meeting concluded, Marcus asked Sarah if they could speak privately. They found themselves back in the hallway where their strange professional relationship had begun just 2 days earlier. Colonel Mitchell, Marcus began, I want to apologize not just for my behavior, but for my assumptions about you and about what constitutes effective leadership. Dr. Sterling, you don't need to, Sarah started to reply. Yes, I do, Marcus interrupted gently. I spent 2 days treating you as if you were subordinate to me when you actually have more military medical experience and probably more leadership training than I do. But, more than that, I failed to create an environment where your expertise could be fully utilized. Sarah studied him for a moment before responding. Your surgical skills are truly exceptional, Dr. Sterling. And your willingness to listen to feedback and consider changes shows real leadership potential. I'd like to learn more about your approach to team leadership, Marcus admitted. If the partnership moves forward, would you be willing to work with me on developing better collaborative practices? I think that could be very beneficial, Sarah agreed. For both the surgical program and patient outcomes. As they stood in the hallway, Marcus reflected on how completely his understanding of effective leadership had been challenged over the past few hours. He had always believed that authority came from technical expertise and hierarchical position, but Sarah had demonstrated that true leadership involved creating environments where everyone's expertise could contribute to success. There's one more thing, Marcus said. I want you to know that working with you these past 2 days, even under false pretenses, has been one of the best collaborative experiences I've had in surgery. I hope we'll have the opportunity to work together again. Sarah smiled genuinely for the first time since her true identity had been revealed. I'd like that too, Dr. Sterling. And I think you'll find that collaborative leadership doesn't diminish your authority, it enhances your effectiveness. As they parted ways, Marcus realized that his encounter with Colonel Sarah Mitchell had fundamentally changed his understanding of what it meant to be a leader in medicine. Technical excellence was essential, but creating an environment where everyone's expertise could contribute to patient care was equally important. His arrogance had nearly prevented him from recognizing the valuable contributions of someone who could help him become not just a better surgeon, but a better leader. The partnership between St. Margaret's Medical Center and the Military Medical Command was approved several weeks later, and Colonel Mitchell returned to help develop enhanced team collaboration protocols. Under her guidance, Marcus learned to balance his surgical authority with genuine appreciation for the expertise of his team members. The result was not only improved patient outcomes but also a more satisfying work environment for everyone involved. Marcus never forgot the lesson he learned from the mysterious temporary nurse who turned out to be a colonel. True leadership in medicine, he discovered, wasn't about demanding respect through authority, but about earning it through competence, collaboration, and genuine appreciation for the contributions of others. And, sometimes, the most valuable teachers come disguised as the people you think you have nothing to learn from.